Hello, my name is Dr. Mark Yacoub, and today I'll explain how to read your first MiDOG All-in-One Microbial Diagnostic Test. On page 1, we begin with the clinician info, including the breed, age, and species of the patient. We'll also include information about the hospital where the patient is being treated, and the sample type. In this case, we're looking at a catheter sample. Further down on page 1, we discuss the potentially clinically relevant microbes that we detect in the test. Here we detect Staphylococcus pseudo-intermediate. This table also includes a link to our animal infectious database. You can click that and it'll tell you information about each pathogen we detect. Also in this table, we show the number of cells per sample and the normal range of this microbe. In this case, we expect 0 to 42 cells for Staphylococcus pseudo-intermedius. Just below this table, we show the clinically relevant fungi. In this example, there are no clinically relevant fungi detected. Further down, we show donut plots indicating the overall microbial abundance. On the far left donut plot, we show the abundance of bacteria relative to fungal composition. In the center plot, we show the relative abundance of each microbacterial species. And then in the far right, we show the abundance of fungal species detected in this test. On page 2, we show the antimicrobial resistance profiles of each pathogen detected in our test. We break this down into groups, indicating R, which is a not recommended antimicrobial due to resistance acquired. Drugs with poor performance, which show less than 50% effectiveness in antibiogram studies. Drugs with fair performance, with less than 75% effectiveness in antimicrobial studies, and drugs with good performance, with greater than 75% effectiveness. We also include these blank cells with no antimicrobial resistance detected, indicating that there is no evidence that they are resistant to these antimicrobials, but it is not supported by antibiogram studies. We also include the suggested dose of each antimicrobial and the drug delivery method, although the suggested dose will vary depending on the patient type. On page 3, we show the total microbial composition. The first plot on page 3 indicates the overall microbial presence of bacteria. You can scroll down and see in the table just below, we've indicated the pathogenic species in red. And again, the link to our AID database. One of the traits of our test allows us to show the commensals as well as pathogens. And you can see the commensal bacterial species just below the pathogens. Many bacterial species are identified to the species level, for instance, Blastococcus. However, others are identified only to the genus level, indicating that they are novel species not yet known to science, but we are still able to detect them with our test. Just below the bacterial composition, we show the total fungal composition. Now, there were no fungal pathogens indicated in this test, but there were still fungal commensals that we identified, including Naganitia and Polyporellus. Finally, on page 4, we show the antimicrobial resistance genes detected in our test. These are specific genes that encode resistance to the drugs indicated in the second column of this table. We can cross-reference this list to what we see in page 2. For instance, we see that this microbe possesses macrolide resistance. And when we scroll up back to page 2, we can show that our pathogen, Staphylococcus pseudo-intermedius, does encode resistance to macrolides.